What News4 Investigates has learned will have you double-checking your insurance policy. A Middle Tennessee man now owes thousands of dollars after being treated for COVID in a local hospital.
And now he is asking why the COVID relief funds aren't helping him with his bills. Investigative reporter Lindsey Bramson started asking questions and found out what you can expect to pay if you should end up in the hospital for COVID.
Hello. We have an important message from Healthcare Receivables Group.
These are the messages now being left for a former COVID patient.
This is a courtesy call from Williamson Medical Center. Our records indicate an outstanding balance.
So I got diagnosed on a Wednesday, and by Saturday morning I woke up and I couldn't breathe.
Because he works for a Middle Tennessee hospital, he's asked us not to identify him. But he now owes more than $4,000 after being treated for COVID at Williamson Medical Center.
I haven't paid it. It's past 30 days, and now I'm just, I guess I'm nervous about what's going to happen next.
Please call 1-615-465-1599.
The calls have been coming for months, along with multiple bills reminding him of his balance. But what he wants to know is, why does he owe this much if hospitals are still receiving COVID relief funds? Money he thought was meant to help pay his bill.
What is it for, if it's not for this?
We started looking into it and found out while hospitals like Williamson Medical Center did receive millions of dollars, it's not to cover the cost of patient care. According to the Health Resources and Services Administration, these funds were created to help healthcare providers. For example, providers can use these funds for salaries, PPE, ventilators, and other expenses related to preventing, preparing for, or responding to COVID-19.
You were under the impression you wouldn't have to pay anything out of pocket.
I was under the impression that it was to cover things like this.
At this point, can patients expect that they may have to pay more out of pocket for COVID care?
Unfortunately, they should expect it.
Healthcare specialist Martine Bruce says insurance companies aren't cutting people slack like they used to. In early 2020, many insurance companies paid 100% of a patient's bill if it was COVID related, but that's not happening anymore.
Insurance companies now consider COVID to be just a regular illness, a regular condition, a regular reason to go to the hospital.
So what can you do to try and prevent a bill like this? Bruce says there are actually ways to make it somewhat disappear. First, make sure your insurance is the correct amount. Mistakes do happen. Second, file for financial assistance. The discounts can be anywhere from 5 to 100%, depending on your circumstances. Lastly, make small monthly payments to keep the account current and keep checking back in with the hospital's billing department.
As of spring 2022, it is expected that 95% of every planned insurance company out there will no longer consider COVID to be special and will no longer cover it at 100%.
While this patient didn't have a choice but to go to the hospital, he hopes insurance companies can be more understanding so that others in a similar situation have more options and aren't surprised by a $4,000 bill.
This is a message from a debt collector.
Lindsey Bramson, News4 Investigates.